Hi, I'm Dr. R Krishnan. I'm Senior Consultant Neurologist at Nano Hospitals. Today I'll be speaking to you on headache. Headache is a very common problem and it affects about 20 to 30% of the general population. Two main types of headaches are there. One of them is called migraine and the second type is called as the tension type headache. So migraine is generally a genetic disease which involves around 20% of the population. Females or ladies are more commonly affected, and it is usually a headache which occurs on one side of the head, and it is a throbbing type of headache or a pulsating type of headache with vomiting or feeling like vomiting, and there is a dislike for light and noise, and this headache can last anywhere between 4 hours and 3 days. And like I said, it is usually a disease which runs in the family and it needs to be treated, because only when you have a diagnosis can be treated properly, and this is useful because it will reduce the stress and certain risk factors which are associated with migraine. The treatment of migraine is simple, but the treatment needs to be taken for a finite period of time, and taking painkillers to treat headaches is not a good choice, because one thing is that painkillers will chronify the headache, will make the headache more chronic, and usually they are more associated with side effects and they can damage the kidneys, etc. So it's always better to prevent the headaches if the headaches are frequent, and then it is very important to have a proper diagnosis done of the type of headache that you are suffering from. There are certain red flags for headache which you have to be aware. So not all headaches are harmless. You have to be very careful when it is a first onset headache, when the headache is very severe at onset itself. If there are any other associated symptoms along with the headache like fever or fits or seizures, or if there is any weakness of limbs, or if there are any underlying clinical conditions like cancer or AIDS or HIV infection or any other infectious disease which are associated with headache. So this is very important to remember, and I request anybody with headaches, please consult a nearby neurologist so that a proper diagnosis can be done and a proper treatment can be given. Thank you.